Hey guys, and welcome to the very first Black Girl Talk sessions. So, today I'm going to talk to you about seasonal affective disorder. Some of you may know it as seasonal depression, others may even describe it as just plain old sad. Well, I thought that this was an important topic to discuss because it is the wintertime, and I've seen an increase of people discussing their seasonal depression, and I've seen tons of questions being asked. So I thought it would be a good idea to bring forth this information, not only in a language that you can understand and receive, but also provide you with the resources that I hope you may find helpful. So before we get started, I want to just tell you a little bit about who I am. I'm a licensed master's level social worker, and I have had experience within the social service field for about 7 years now. My expertise or area that I work in the most is in childhood trauma, family violence, and I like to utilize theories such as trauma informed care, CBT, family systems, and strengths based theories. So let me tell you a little bit about the Just More Hope platform. And it's a platform that I created in a way for me to provide education and support for young women of color like myself, and educate you guys on how mental health can affect every aspect of your lives. Just More Hope was also created to create safe spaces for young women, whether it's online or in person, to share their experiences with each other. So the topics that I will be discussing with you today are obviously an overview of what seasonal affective disorder is. I'm going to talk to you about the signs and symptoms to look out for, as well as who are the most at-risk groups for being affected by seasonal affective disorder. I'll also share with you some treatment information as well as some bonus information. If you stay to the end, you'll get a lot of good resources. So first things first, what is seasonal affective disorder? So seasonal affective disorder, or SAD, is a type of depression that comes and goes with the seasons. It typically starts in the late fall or early winter, and it goes throughout the summer and spring months. The most difficult months that people in the United States who've been affected by SAD tend to be January and February. SAD is more than just winter blues. The symptoms can be distressing and overwhelming, and it can interfere with your daily functioning. However, it can be treated. So one thing I want to let you guys know, because I've seen a lot of this online, is that seasonal affective disorder or seasonal depression or SAD, it is not considered to be a separate disorder. SAD is a type of depression, and it displays within a recurring seasonal pattern. So in order to be diagnosed with SAD, people must meet the full criteria of major depression disorder. But the difference is your depressive symptoms coincides with specific seasons. So seasonal depression must be much more frequent than any non-seasonal depressions. So what that means is, let's take someone with depression diagnosis versus someone with seasonal affective disorder diagnosis. So in order to differentiate between those two, they both have been diagnosed with the baseline major depression disorder, right? Okay, so the one with only the major depression disorder, they will present as showing the signs and symptoms of depression, but however, their signs and symptoms are pretty baseline throughout the years. So there is no real fluctuation in their symptoms in the summer versus the winter. So their symptoms will occur in March the same way they will occur in July. There's really no difference. However, the person with seasonal affective disorder, they will be diagnosed with major depression disorder, and throughout the year, specifically during warmer months, they can appear to have no symptoms. They may even feel like they're getting better. However, during the colder months, during the winter months, that's when their signs and symptoms seem to exacerbate. So it's not as though they are not diagnosed with depression at all. It's just that their symptoms are more related to the season change. So, did you know that about 5% of adults in the United States experience SAD, and it typically lasts about 40% of the year? That can equate to about 3.5 to 4 months of the year. And it makes sense because let's just say someone who's been affected by SAD, they may feel as though their symptoms are exacerbated during the months of, let's say, November, December, January, and February. Okay, so in order to better understand seasonal affective disorder, I first want to talk to you about the signs and symptoms of major depression. So basically, there's an overwhelming sadness and lack of motivation that you could feel most of the day and nearly every single day for an extended amount of time. Um, People who experience major depression, they also have a feeling of hopelessness and worthlessness. Sometimes it can be triggered by events, but sometimes it could have no triggering event at all. And that can lead to possibly low energy, feeling very lethargic, being very tired all the time, and losing interest in activities that you once enjoyed. That could create problems sleeping. You can either sleep way too much, or you could have some very disruptive sleep, or you cannot sleep. You cannot get any really good quality sleep. And a lot of times, the lack of sleep or insomnia is triggered by anxiety, which is also a sign or symptom of major depression. And like I mentioned earlier, you can feel very sluggish, just have no energy, and feel very agitated. Like something small can really get you upset. You also have difficulty concentrating, and there could be frequent thoughts of death or suicide. So, what about the winter months? Those with seasonal affective disorder, they may have additional symptoms to the typical symptoms of major depression, and that can include having super low energy, also hypersomnia, meaning sleeping way too much. I almost think of it as someone wanting to hibernate and just stay under the covers in the bed and sleep for as long as they can. And that also will create some social withdrawal because you want to stay isolated. And a lot of times it has to do with the climate change because, as you've noticed, people in the wintertime, they are less likely to go out because it's too cold and nobody wants to go out. So that does create a sense of isolation and social withdrawal, and that can contribute to your desire to want to sleep because you're in the house more often than you are in the summertime. And when you're in the house and you're sleeping and you're lounging and you're super tired, what else do? You eat. So seasonal affective disorder also has a eating component, a eating symptom, and that's mainly overeating, which will lead to weight gain. And the reason being that weight gain is an issue is because we mainly crave carbohydrates in the wintertime. So those with seasonal affective disorder, they will crave carbohydrates a lot more than if it was the summertime. And so obviously craving those carbs, eating more, moving around less, that creates the weight gain. And most people are less likely to go out in the cold weather, to go to the gym in the wintertime versus the summertime. So all of this just plays a part in the increase of symptoms of seasonal affective disorder. So the next thing I want to talk about is seasonal affective disorder in the summertime. Now, this is less common, but it can happen. So the first thing is poor appetite associated with weight loss. Just like in the wintertime, when it's the summertime, most people are out and about. They're not eating as much. They're moving around more, so that can contribute to the weight loss. But also, there is insomnia because anxiety increases, agitation increases, restlessness increases. So it's a more likely chance that someone who has seasonal affective disorder suffer from insomnia in the summertime versus insomnia in the wintertime. Another sign and symptom of seasonal affective disorder during the summertime is episodes of violent behavior. And if you've ever watched the news, you've always learned that violent behavior increases in the summer. And it kind of makes sense because everybody is walking around, they hot, they bothered, they agitated, they don't want you in their space. So it makes sense that violent behavior can be more prevalent in the summertime than in the wintertime because one, we are socializing more, so we are around more people in the summer. But also our agitation increased tremendously. Road rage is likely to be increased in the summertime than it is in the winter months. So these are some signs and symptoms to watch for those who may be affected by seasonal affective disorder in the summer. So let's talk about the risk factors. Did you know that being a woman, you are more likely to be diagnosed with seasonal affective disorder? In fact, you are 4 times more likely to be diagnosed than men. And that means 4 out of 5 people who are diagnosed with seasonal affective disorder are women. That's nearly 80% of diagnosed seasonal affective disorder being women. So, what are some other attributes that may increase your risk of seasonal affective disorder? Okay, so the first and biggest is where you live. The further away that you live from the equator, the more prevalent seasonal affective disorder can be in your life. So basically, those who live further away from the equator, such as those who live in Alaska or New England, they tend to see longer nights, shorter days, and even during the day, the days may seem very gloomy. There's really not a lot of sunshine. So they tend to have a higher prevalence of seasonal affective disorder than those who live closer to the equator. Another risk is your family history. So people who have a family history of other types of depression are more likely to develop seasonal affective disorder than those who don't have a family history of depression. Having depression or bipolar disorder can put you more at risk for seasonal affective disorder. And if you heard me talk about how people's symptoms may exacerbate during the winter months or the summer months, it can almost sound as though it's someone who have bipolar depression because they may be super manic during the summer or very depressed during the winter. So if you have a diagnosis of bipolar disorder, just know that the symptoms of seasonal affective disorder can worsen those conditions. The next risk is younger people. So your age definitely plays a factor in the risk of being affected by seasonal affective disorder. Younger people or younger adults have a higher risk of SAD than older adults. Seasonal affective disorder or seasonal depression has also been reported even in children and teenagers. So the younger you are, where you live, your family history, and your history with other mental health disorders can all play a factor in you being affected by seasonal depression. So let's talk about some biological factors. Now, the cause of seasonal depression is unknown, but there is some research out there that have found these biological clues to be very prevalent in seasonal depression. The first being those who suffer from seasonal depression, they have trouble regulating their serotonin. So I am no biologist, but I'm going to try to paint this picture as clearly as I can. So people with seasonal depression, they have trouble regulating serotonin. And what that means is that studies have shown that people with seasonal depression have 5% more serotonin transporter protein in the winter months than they do in the summer months. So what does that mean? Here we go. Let me try to paint this picture. Okay, so let's just say you're in a house and there's a lot of stuff in your house and you have your front door open and you invite movers to come in and pick the stuff up and put it outside, right? The movers are considered your transporter proteins. That means in the wintertime, there are 5% more movers transporting things from inside the house to outside the house, which results in what? A lack of things inside the house. So that means there's a lack of serotonin within our bodies, within our I guess our bloodstream or wherever the serotonin is, there's a deficit of serotonin because there's an increase of transporter proteins taking it out and disposing of it. So that means that the higher the transporter protein in your body leaves less serotonin available for the function of what serotonin does, which is regulate your mood. Another biological factor is that people with seasonal affective disorder may overproduce the hormone melatonin. We've all heard about melatonin. People may be taking it to get better sleep at night because they may suffer from insomnia. So we all know that melatonin is a hormone that is associated with sleep. And what it does is it regulates our sleep. And melatonin is affected by darkness. So darkness can increase the production of melatonin. So when the winter days come, they are shorter and melatonin production increases because the days are, the night time or even the dark time during the day is longer. So your body associates the darkness of the day and the longer nights with producing more melatonin. So with the production or increase of melatonin, that leaves people feeling a lot sleepier. You may feel more lethargic during the day. You may sleep heavier at night. You may sleep longer at night. You're more likely to miss your alarm because your body is naturally producing more melatonin during these months than during the summer. And basically what I've explained is pretty much the result of your internal clock being out of sync with external clocks. So basically, if you've ever noticed whenever when daylight saving time changes, we are kind of out of whack with our sleep, and we get tired earlier. We get, I don't know, depending on which season it is, it really affects our sleep. So that basically means our usual sleep wake rhythms are out of sync, or our internal clocks are out of sync with what's going on with the world around us. And obviously this can result in some of the symptoms associated with seasonal depression. So people with seasonal affective disorder may also produce less vitamin D. So vitamin D is believed to play a role in the serotonin activity. Vitamin D insufficiency may also be associated with depressive symptoms. So you all know we get vitamin D pretty much from the sun. The sun is introduced to our body and our body produces the vitamin D. Now, if there is a lack of sunshine, if the days are shorter and the nights are longer, that means there's a lack of vitamin D production in our bodies. And so that can be a biological sign of seasonal affective disorder. So I've talked to you about what SAD is. I've told you some things, some signs and symptoms to look out for. I told you about what groups are most at risk for seasonal affective disorder, as well as the biological components that can be associated with seasonal affective disorder. So now let's talk about the treatments and therapies that can treat and help seasonal affective disorder. The first thing we're going to talk about is light therapy. So light therapy has been a mainstream treatment for seasonal affective disorder and has been known to be very effective since about the 1980s. Or the idea behind light therapy is to replace the diminished sunshine of the fall and winter months using a daily exposure of bright artificial light. So what that does, that means it involves sitting in front of a light, like I said, artificial light. And like I said, it emits very, very bright, and it also filters out the harmful ultraviolet rays. And it usually requires at least 20 minutes or more of sitting in front of a day. And typically you do this early in the morning before you get your day started. It's almost like waking up to bright sunshine. If you've ever been wakened by the bright sun beaming in through your windows, it kind of makes you feel better. So this is what light therapy is trying to portray. Now, the thing about light therapy, you don't start it and stop it once you start to feel better. The way to maintain those benefits and to prevent the relapse of seasonal affective disorder symptoms is to maintain this treatment throughout the winter months. So the next treatment is psychotherapy. So CBT, or cognitive behavioral therapy, is a type of psychotherapy that has also seen to be effective with treating seasonal affective disorder. In some areas, you may be able to find therapy that is CBT specific to seasonal depression, but it pretty much relies on basic techniques of CBT, which means identifying your negative thoughts and replacing them with more positive thoughts. As you all know, talking about your issues, or talking about your problems, or talking about how you feel is always helpful. If you've ever just sat on the phone and talked to your girlfriends or your boyfriends about what's going on, you seem to, get that release. And that is exactly what psychotherapy does. It allows you to speak with a licensed, trained mental health professional, and receive feedback as well as tips and tricks on how to modify the behavior that will in turn change your thoughts and increase your mood. The next treatment is, I guess there's a lot of different arguments surrounding treatment using vitamin D. Before I suggest you use vitamin D, you always consult with a medical professional before taking any medication or supplement. And the reason I say that is because with vitamin D, it is a fat soluble vitamin, so there is a risk of toxicity. And before you just start popping pills, popping supplements all willy nilly, the first thing you want to do is determine what your current vitamin D levels are. And that requires that you receive or you get blood work done. And you can only get that done by a medical professional. So don't start taking vitamin D pills until you know what your baseline levels of your vitamin D blood levels are. And because there's a risk of overconsumption of vitamin D, what I've learned is that it is not safe to start taking these supplements at the highest dose. You can go online, you can go in the stores, and you will see a lot of 5,000 IU supplements out there. Now, I believe IU means like international units, but from what I've researched, a lot of times 5,000 IU tends to be more than what you need. And again, like I said, if you continually take these on a regular basis, you could increase your risk of toxicity. So what I've recognized over throughout my research is that 2,000 IU is the safest route to go when you're taking vitamin D pills or vitamin D supplements, unless it has been specified differently by your medical professional. I always like to say, with taking any medication, always start low and go slow. That means you want to be able to take the lowest amount of medicine that will provide you with the most help. You don't want to start out taking the highest dose when you don't necessarily need it. So I always say start low, go slow. You can start out taking 2,000 IU supplements, and if your doctor recommends you go up, or if your vitamin D blood levels seem to not change, then you can talk about going up to a higher level. So I always recommend starting low and going slow. Now, if you've done the psychotherapy, you've done the light therapy, you may even taken some vitamin D supplements, and none of that seems to really get you where you need to be or where you feel like you need to be, then that is when you can talk to your mental health professional as well as your medical professional about utilizing medication to combat the depressive symptoms. And you do that by taking antidepressants. So the antidepressants that are most effective in treating depression or seasonal depression are what we call selective serotonin reuptake inhibitors. I know that is a long name, but just know they're called SSRIs for short, and they're used to treat SAD. And you remember when I was talking about earlier the biological factors of there being a deficiency of serotonin because there's an increase of transporter proteins, then that means the selective serotonin reuptake inhibitors, they are meant to replenish what's been depleted of your serotonin. And that promotes an increase in your happy mood because it increased the serotonin in your body. So you've made it to the end of this presentation. Now I want to provide you with some resources that could be very helpful if you are affected by seasonal affective disorder. So the first resource is the portable lamp light therapy lamp. And you can find all of these items in the description box below, so don't forget to check those out. So this particular portable light therapy lamp, you can set it in front of you while you're brushing your teeth or doing your hair or your makeup or cooking yourself breakfast. And that is what I like most about this particular lamp, because it is portable. If you like to travel and you tend to travel to places that are a lot more gloomier than others, you can throw this in your travel case and take it with you. Another thing that I like about this particular light therapy lamp is that it emits about 10,000 lux of cool white fluorescent lights, and that is about 20 times greater than ordinary indoor lighting. But also, it's supposed to mimic sunlight, so it's super bright. But the good thing about that is that it filters out the ultraviolet, the harmful rays that could cause cancer. So some of you may be asking, well, what's the difference between this lamp and me just going outside? Well, if you are affected by seasonal affective disorder and you live in a place where there is a lack of sunshine, then you can go outside as much as you want and it won't change your mood because there is no sunshine. It feels, or it looks a lot more cloudier than if you were living in, let's say, somewhere like Florida. So if there is no sunshine to go out into, then the next best thing is using one of these light therapy portable lamps. I hope that makes sense, guys. So the next is this brand of vitamin D3 supplements. This is the Nature-Wise vitamin D3 brand, and the reason why I prefer this brand over any other brand is because it is, first of all, it's encapsulated and olive oil soft gel. And so what that means is, like I mentioned earlier, vitamin D is soluble in fat. So that means you need fat in order to better absorb it. And so you will be able to reap the benefits more if you were to take this medicine, because it is encapsulated in olive oil. So it's combining the fat that you need to absorb it along with the actual vitamin D supplement. And as you know, olive oil is a healthy fat. This particular brand is 2,000 IU. There's a lot of 5,000 IU out there, but this particular brand is hardly any other brands out there that has the 2,000 IU and also encapsulated in a olive oil soft gel. So that is what makes this particular brand one of the most recommended brands. Now, this brand may not be the cheapest, but it's probably going to be the most effective for you. And not only that, it has 360 capsules. That means this particular brand of vitamin D supplements will last you an entire year. Okay, so the next resource is our very own Black Girl Talk session resource, and this is free for you, and it is our Black Girl Talk session mood scale. And so this scale is a way for you to monitor your mood, and I find it especially helpful when and if you decide to seek professional help, to have some tangible documentation of what you've experienced over, per se, an extended period of time, maybe 2 to 3 weeks, up to 30 days. It's always helpful in creating a treatment plan or being able to convey to the medical professional what's going on with you if you've been monitoring what's going on. You know, we all go to the doctor and we try to tell the doctor what's going on, and they ask us, well, how many times, or when was the last time? And you're like, maybe twice in the past month, maybe one time this week. I'm really not sure. So this just gives you a more accurate, detailed recount of your mood, and it's very helpful for those who seeking to treat whatever you're going to the doctor to get treatment for. So if you're using this for seasonal affective disorder, it's very helpful to have something to refer back to rather than trying to just rely on your own memory because, child, I'm getting old. I don't remember anything. So, this will be very helpful. Another thing this is really good for is tracking not only your depressive symptoms, but also your upward progress of those symptoms. So the goal is to increase your mood, to decrease the negative feelings. And so this is a great way to keep track of, my mood has been at a 9 for the past 30 days now. And that is a way for doctors to say, let's adjust this medication, or we can increase the dosage or decrease the dosage. But it's really all reliant on how you report. And if you want to be more accurate in your reporting, then I would suggest using some type of documentation. And I've already done it for you. All you have to do is click the link and download it. So as I wrap up this presentation, I just want to leave you with my final thoughts, and it is a quote by Julian Sifter, and that is, "You are not your illness. You are an individual with a story to tell. You have a name, you have a history, and a personality. Staying yourself is part of the battle." And I can relate to this because for those who may suffer from seasonal affective disorder, sometimes it may feel like you can't be yourself because when the seasons change, your mood automatically changes. And that can last, like I mentioned earlier, for 40% of the year. But you have to know that you have to continue to fight because this seasonal depression isn't who you are. It doesn't identify you. You don't have to struggle with seasonal affective disorder. What I would suggest, you learn to surrender to those moments where you don't feel good, where you don't feel your happiest, and learn to show yourself grace. And most importantly, just move your body. Sometimes you have to set very, very small goals in order to increase your mood. You don't have to conquer the world in one day when you're going through these depressive episodes, but little things like, let me hang my clothes up today. Today, let me clean the shower. Today, let me do the laundry. Today, let me just wash the dishes. Sometimes you have to start really small in order to get that momentum. But another thing is, don't hide your sadness. We've been conditioned to hide how we feel and just say, we're okay, when we know deep down, we are really struggling. So the best way to overcome your sadness and overcome your depression is to talk about it, because I guarantee you someone else may be able to relate. It just goes to show that you are not alone in this process, and you can do that by joining the Facebook group, the Black Girl Talk group, because this allows for a safe space for you to talk about your seasonal depression or any other issues you may be facing. This place is full of women who may be having the very same experience, and so it just allows an opportunity to have other women support you and also share their experiences with you in ways that you may be able to overcome whatever obstacles you may be facing at the time. All right, guys, so you have made it to the end of this presentation. Thank you guys for staying with me. Thank you guys for watching. I want you to know you can always connect with me on social media at Just More Hope. Just More Hope is my handle on pretty much all of social media. You can email me at hope@justmorehope.com, or even log onto my website at www.justmorehope.com. If you guys found this video helpful and interesting, and you know someone who may need this information, please share this with a friend. Share it on your social media. And again, don't forget to tag me when you do at Just More Hope and use the hashtag Black Girl Talk in Session. That's all I got for you guys. Until next time, bye.